name is Dr. Manjunath Haridas. I'm a Colorectal and GI Surgeon from the Department of Gastrointestinal Sciences, Manipal Hospital Whitefield. I'd like to welcome you all to the first episode of GI Talk. Today we have Dr. Balaji and we have Dr. Anoop, who will discuss about the most common disease that is actually being ignored a lot, gastritis. Dr. Balaji, can you please tell me who are the patients who are prone to have gastritis?
A generalized increase in the weight of a body and because of long sitting hours, most of the people are suffering from these gastric issues. It is seen in the worldwide literature. Over the given point of time, 20 to 50% of the population, one or the other time of life, they suffer from the gastritis.
So it is very common.
Very common disease nowadays.
Okay. Have you seen any increase in gastritis since the COVID, do you think?
Yes, definitely. It may be partly contributed by the virus and also maybe because of the medications. We have seen a surge in the cases of patients coming to us with the common the term what we use is dyspepsia. Dyspepsia has been very common.
In terms of evaluation, what are the things that you usually do for evaluating? Say a patient who just got COVID and he comes to see you saying that he's post-COVID and he has tummy aches. So what would you do?
So we basically it needs clinical evaluation. We take a detailed history of the patient, mainly to assess if the patient has any alarming symptoms in the form of weight loss or vomiting, loss of appetite, or any evidence of any GI bleeding, or if they have anemia. If they do have these alarm symptoms, yes, we do recommend them for upfront. We offer them diagnostic evaluation in the form of endoscopy.
Dr. Balaji, what do you think about patients taking over-the-counter medications for gastritis? Is it okay, or do you think that it is probably not a right thing to do?
Generally, like most of the people, one of the times they go and take over-the-counter medications. If, as Dr. Anoop discussed, if they don't have any lack of appetite, if they don't have any severe pain abdomen, if they don't have any weakness or blood in the vomiting, blood in the stools, if they don't have all these warning symptoms, they can take a trial of medications. Only I would recommend maybe once or twice. But if it is a recurring problem, if it is persisting more than 4 weeks, I would definitely recommend them to visit a doctor. But if they have these warning symptoms, better not to go for over-the-counter drugs and directly visit us.
So what are the evaluations that generally a patient with gastritis would need?
So when you to be specific, when we are discussing about GERD, so there is no gold standard test to confirm or diagnose GERD problem. It is a combination of the clinical presentation and endoscopy for objective evaluation of any injury to the esophageal mucosa, and in some instances we might need reflux monitoring, and also we see the response to the therapy also. We have to decide which patient needs endoscopy, which patient needs manometry, or which patient needs reflux monitoring testing.
Young people, somewhere between 20 to 30 years, who have taken over-the-counter medication twice, and they have come to me saying that, you know what, my gastritis is not getting better. And I myself have followed what you have said, lifestyle modifications and all the stuff I advise them. But when they actually come back, what do you usually recommend them to do? Do they immediately need endoscopy, would you say, or what would you do?
Yeah, even the latest guidelines say if the patient is not responding to the therapy, or if they have a recurrence after the discontinuation of the therapy, what we call it as trial of PPA. Yes, I think first investigation of choice should be the upper GI.
So endoscopy is definitely a must.
It is not only to diagnose GERD, but also we have to rule out other diseases, especially malignancy, and sometimes there can be allergic diseases of the esophagus, and sometimes peptic ulcer disease also.
Adding to that, sometimes they have a stricture. What is that? Stricture means narrowing of the food pipe. Sometimes we do have a gastric ulcers. Sometimes it may be malignant or non-malignant ulcers. better to rule out those things before we label them as having a simple what we tell gastritis or reflux. And another important thing is generally most of the population do have H. pylori infections whoever has a gastritis symptoms. We have to evaluate for that and treat for a sustained relief in the symptoms.
Is endoscopy painful, do you think?
No, it is not painful at all. It is very simple procedure. It takes 1.5 to 2 minutes.
And you do it in the outpatient?
Yes. We do it in outpatient basis. Like first we give the spray to decrease the sensation in the throat. After once his throat gets decrease in the sensation or anesthetized, in the awake only we insert a small fiber optic tube, which is almost a diameter of maybe 8 mm. So in conscious we put a tube into the esophagus, that is food pipe, we go into the stomach, and the initial part of the small intestine, that is we tell the duodenum, we see, and it is a quick procedure. We go in, will come out. Mild discomfort might be there. They may have some throat irritation, sometimes some bloating sensation during the endoscopy.
But they can go home the same day?
Yeah, they can go home same day, and after the procedure maybe 20 minutes they can have food and
so they get back to the normal life. So it's not something that you would recommend that it is something that they have to wait or fear about?
Yes.
Definitely. H. pylori infection seems to be a very frequent one. How many times can you get treated for H. pylori infection?
If you see the prevalence of H. pylori infection, even in general population in India, it's around 60 to 70%. We are doing endoscopy, definitely the patient has.
So we can diagnose H. pylori immediately?
Yes, during the endoscopy itself, since already we are doing endoscopy, we can take a tissue from the stomach and we can do this rapid urease test, which is a
so that assessment is definitely helpful for the patient.
Yes. If the patient has dyspeptic symptoms and if he has H. pylori, there is a treatment, definitely. With the treatment, the success rate is nearly 85 to 90%.
That's very good.
Patients definitely get a long-term relief with the
so it is. So it becomes even more important that patient come for endoscopy for evaluation of GERD and gastritis-like symptoms.
Especially patients who have GERD and with H. pylori infection, definitely eradication of H. pylori will reduce the requirement of the medication for a shorter duration, and also they get a good
assessment as okay. Now in terms of severe GERD, we know that there are some category of patients who actually require surgery. I mean, that is going to be Nissen fundoplication, where we take the stomach and wrap the stomach around the esophagus to prevent acid reflux. Now I'm pretty much sure there must be other options available as well. So what endoscopic procedures are available, do you think, that we can offer?
Of late, we tell endoluminal procedures. Of late, these procedures are becoming very popular. What we do, we go through we do the endoscope, especially the condition called hiatus hernia, where that lower part of the esophagus becomes loose. In those conditions, that looseness, we grade them. Grading other 1, 2, 3, 4. If they have a early grade hiatus hernia, through endoscope we tell arms procedure, latest one arms procedure or arm procedure. We go with the endoscope, the mucosa, the tissue around the esophagus, that junction of the stomach and esophagus, we make it tight using various methods. Are there now that clipping comes through the endoscope, that is called Colorectal and other things. What we can do is just burn out the mucosa surrounding that. It will become tight, little bit tight, and they will have a very good sustained relief of the symptoms. Many of the times they will be off the medications.
So prior to these endoscopic procedures, would you advise them to have any kind of evaluation, do you think, or?
Yes, especially when we are planning endoluminal procedures, we have to carefully select these patients.
Okay.
Whether they really have GERD or whether they have any, because before endoluminal intervention, we need to do a reflux, 24-hour pH monitoring and also high resolution manometry of the esophagus. So the reason is, with high resolution manometry, we can assess if the patient has any motility disorder of the esophagus.
So basically you are looking at how much acid is coming out and also looking at whether it is functional.
The motility of the esophagus is normal, and also we need manometry to assess for the probe placement, so that we can carefully select the patient who definitely benefit from the with endoluminal procedures or surgical intervention?
So basically, I mean, surgical patients, as from what I can tell you, we are very clear. There's a clear definition of who are the people who would need or who would definitely benefit from Nissen fundoplication, and that has been known for quite some years now. But I think the 20% of the patients who are not so surgical disease, but not less that we can medically manage, and I think that is the chunk of the patients.
Endoluminal procedures, it fills the gap between the medical management and
the surgical management.
Yeah.
Okay.
That lacuna is filled with endoluminal procedures.
Now there is this thought about medications. You talked about long-term medications. Now, is there any data to show that taking long-term proton pump inhibitors for a long term has some effects? I mean, we know that medications always has some effects, but is there anything that actually says, you know what, if you're taking proton pump inhibitors for a long term, you may be looking at some side effects of it?
There are some literature saying that some effect are there. Some literature is saying that there is no.
So both ways you.
Both ways.
Controversial thing. So it's not been proven.
Not being proven, but still long-term medications can cause any kind of a harm that we don't know yet.
There are certain indications where we might have to give it for a long term PPIs.
So basically, endoscopy looks like this is the key for evaluation. So any patients who has symptoms or not responding to symptoms, the first step is probably going to be the endoscopy, because I think that rules out almost a large chunk of patients who can get better or who can actually would benefit just with surgery instead of going through the trials of medications and other treatments. So in terms of complications of endoscopic procedures, are there very high complications compared to laparoscopic, or are they less?
Endoscopic procedures complications are very minimal,
because it's done endoscopic and it's done within 24 hours.
24 hours. Some procedures do have minor adverse effect, saying that they may have some chest pain. Post procedure 3-4 days they may have chest pain and minor complications. Usually they can be handled.
They can recover very well from
very
it.
well.
Now, say for example, we know that we are dealing, at least in the place that we are right now, we have a lot of young population. Now, if a young population comes to you for the first time and says that he went outside and he had some food and he did the same thing the next week and he was under pressure trying to get his work timeline to be met, and he has a little bit of a gastritis, what would you advise him?
So actually this lack of sleep, stress and all those things usually precipitate GERD or some gastritis. Increase in this thing. So basically overall, if you put it in the bracket, it is a lifestyle change is very important. Very important in those patients who have mild symptoms and related to factors attributing to the lifestyle. Lifestyle changes will give sustained relief.
So then if they do the lifestyle changes but they still tend to have these symptoms, then when they come to you, do you start them on medications or would you recommend that?
Modifications are it is a supportive treatment in management of GERD, where the PPIs or proton pump inhibitors are the mainstay of the treatment. So definitely it will help in reducing the symptoms, like especially elevation of the head and the bed, reduction of weight in especially obese and weight loss, overweight patients, and also avoiding something called trigger foods, especially citrus fruits, fatty, oily and carbonated beverages, avoiding these things, and especially avoiding meals at least 2 to 3 hours before going to the bed. So these are some simple lifestyle modification which can be followed along with the medications to definitely
So
benefit.
basically we come to a conclusion that majority is going to be lifestyle, and I think if you control the environment that you are in, your symptoms are less, and when you control the environment you still continue to have symptoms, you're just better off to actually evaluate properly, because we know that we will miss some esophagitis or an ulcer disease or maybe even malignancy in some patients. I recently actually, I should say that a 40-year-old person actually had the same gastritis symptoms and he was found to have a carcinoma. So I am pretty much sure we don't want to miss all those.
Age is not a, previously we used to say old age is, there is a risk of malignancy, but we see even in young patients we see malignancies.
So as well.
It is no longer that it is an age related problem.
So definitely endoscopy is a minimum, at least in this time, to make sure that you don't have anything that is harmful. Dr. Balaji, what would you really advise as a take-home message to young people about what they should, if you were to put it in one sentence, what they should and they should not?
GERD is a very common problem, and if they are taking over-the-counter drugs, the maximum duration I would recommend patients who don't have any, I would tell, warning symptoms, they should give a trial maybe 2 to 4 weeks, not more than that.
Okay.
Along with that, if they have a lot of chest pain and chest related symptom, better to visit us.
So we do have the facilities for evaluation of the Department of Gastrosciences at Manipal Whitefield.
Endoscopy, we have high resolution manometry, and we have 24-hour esophageal pH monitoring test also, which is essential for the comprehensive evaluation of this problem.
Yeah, I mean, we definitely offer surgeries. We are very happy to say that we can also offer the endoscopic procedures in that subcategory of patients whom we can actually selectively offer ARMA type of procedures where it is endoscopic technique. I'm pretty much sure there is a lot of options that is available. Patients who actually have a look at this will understand a little bit more about the GERD. So once again, thank you Dr. Anoop, and thank you Dr. Balaji. And hopefully with this GI talk, a little bit more knowledge about what to do and what not to do. The Department of Gastrosciences at Manipal Hospital Whitefield has facilities that is available not only for evaluation but also for surgeries as well. So we also offer laparoscopic surgeries and also endoscopic procedures for GERD and GERD related diseases. Once again, thank you for your time.
Thank you.